Hey guys, welcome back to Talk to Me Sister podcast, season 2. If you're new to the pod, we're twin sisters and a ton has happened since last season. I'm a cancer survivor. Kathy had my baby. The baby's here, happy and healthy. Yes, and we're advocates for women's health, and we're going to cover a lot of topics this season. So thanks for following along. Hey guys, welcome back to Talk to Me Sister podcast. We are here today with Susan Marks. She is a cannabis nurse and a member of the American Cannabis Nurses Association. Susan is a native Californian and received her Bachelor's of Science in Nursing from Mount St. Mary's College. She has clinical experience in adult medical, surgical, pediatric oncology, hematology, home care, case management, disease management, quality improvement, and risk management. Oh my gosh, Susan, you are a wealth of knowledge, and we are so excited to have you here. This is a topic that means a lot to me, and I, as a cancer patient and somebody that partook in cannabis for treatment and side effects, we have a lot of questions for you today.
Yeah, and one thing we love is I think a lot of people talk about all of this on the internet and don't necessarily have the qualifications. So we're excited to hear from someone who is qualified.
Very good point.
And Susan also works with medical patients who want to include cannabis in their management programs, like along with their clinical interventions. Yeah. And Susan educates and consults clients on, how do we say this?
Endocannabinoid system. Did we say that right?
Perfect.
I love it.
That's a tongue twister.
It's a big word. But this I love is that you work with people on how to select safe and reliable products, dosing, risks and benefit, and drug interactions, which sometimes they don't think about, but it's really important if you're someone like Sarah who was going through chemo, and understanding how it can work alongside as like an integrative treatment. So, wow, this is incredible. We are so excited to have you.
Thank you. I am very excited to be here, and I'm really looking forward to this. I love talking about cannabis. I love educating people. It's such a valuable resource for everybody, and so few people know about it. So I really appreciate you asking me to be on your podcast.
You're wonderful. Well, thank you. And tell us a little bit about you, like how you decided to really focus on this after you studied kind of Western medicine and became a nurse. How did you become passionate about CBD and cannabis for your patients?
Well, I was never a cannabis user. I mean, in college, I would smoke a little bit, but I just preferred beer and wine way more than cannabis. So
recreationally,
right. So it was completely off my radar screen until I hit around, 50 years old, and I have a progressive neurological movement disorder. It's called essential tremor. And so it had got around the age of 50, it had gotten to the point where my hands were shaking so bad. I couldn't drink out of a glass. I couldn't button my shirts. Oh, wow. I was losing my independence. It was embarrassing to me to go out to a restaurant and try to use a fork. I would never order soup because I couldn't hold the soup in the spoon. All these things you kind of adapt to what's happening, but it really does take an emotional toll and a physical toll, because the only treatment for essential tremor are anticonvulsants or anti-seizure medication. And those are very, very strong barbiturate anticonvulsants, and they really messed up with my head. And so I was desperate to find an alternative. And so I got on YouTube, I got on PubMed, which is the National Institutes of Health, their public database of medical information. So I was, just trying to find alternative treatments for seizures, for Parkinson's, because that's very similar to essential tremor, just to see if I could figure out some other way to manage this. And I stumbled on cannabis, and I'm a little embarrassed now to say that when people would talk about medical cannabis, I would kind of roll my eyes and smile, thinking, yeah, it's great for for cancer patients. But other than that, it's, air quotes, yeah, it's medical.
Right. Like sure. Yeah.
Exactly. But then once you get into the research of it, I was shocked to find more than about 25,000 research papers on cannabis, all the way back to the 1960s, 1950s, from a scientist in Israel. His name is Raphael Mechoulam, and he was kind of the pioneer. One of their very first research papers was about kids who had devastating epilepsy, where they were having 300 seizures, a week, and how cannabis really practically eliminated it. It didn't eliminate it completely, but so I thought, okay, well, if that works to stop the seizures in kids, maybe it will work for me. So anyway, to make a very long story short, I just absorbed all of the information on it as I could. It made me very hopeful that there was an alternative there for me, which at the time meant everything. And number two is I wanted everybody to know about this. I thought, okay, I've been a nurse for 35 years. Right. Why haven't I heard about this? Why aren't clinicians talking about this? And so I just kind of made it my mission to talk as much and to as many people as I could, just so that they knew that this was available to them. And so for my own journey, I had to do a lot of trial and error with different products at different dosages and different protocols. And I finally found a protocol that worked for me, which is basically a high CBD with some raw cannabis, which is THCA, and a little bit of THC at night. I don't like that intoxicated feeling. And a lot of my patients don't like that either. And for anybody out there listening who has that issue, just know there are a lot of ways that you can get around not having to deal with that. So don't let something like that stop you.
That's such a good point.
Yeah.
Because I feel like even when I was, taking some dosage, people would always ask me like, oh my gosh, I don't like the feeling of not being in control or functioning. But I think that depends on the dosage, and it's important to know that when it's used medically, you don't have to feel incapacitated, right? Is that your message?
Yeah, that's exactly right. The plant itself is like a treasure trove of pharmaceutical opportunities. And the plant has more than 150 cannabinoids in them. There's only really one that gives you that intoxicated feeling, which is THC. And all the other 149 compounds in the plant have medicinal effects. So if you just limit the amount of THC or, completely eliminate it, then you can get all of the medical therapeutic benefits without having the intoxication. If you need THC, because whatever condition you're trying to manage requires a little bit of THC, like in my case, I simply take it at night before I go to bed. I sleep like a baby. I don't have to deal at all with any intoxication, and I wake up feeling refreshed. There's none of that kind of hangover feeling that you get from, sleeping pills or even Benadryl.
Right. And it's so interesting because I think so many people are nervous about CBD even, but THC and cannabis in general, but are okay with taking, okay with taking lots of Benadryl and Tylenol PM and all this, all the stuff that can be such high side effect and then leave you feeling drowsy the next day. And often THC doesn't do that, right? So you're helping people find the right dose. How do you do that? Is it just working with them problem shooting? How do you that seems tedious to find everybody's correct dosage.
Right. I bet it's client to client, but how do you approach a new client?
So, yes, it is individual for everybody, and you have to take in some major variables such as age. So the older you are, the slower your metabolism, the less cannabis you need. And I say cannabis, and I mean CBD and all the other compounds, not just the intoxicating version.
Right.
So the older you are, the less you need. The younger you are, the more you need, because you have a much higher metabolism. And then for everybody, you need to start with a very low dose and increase it over time, little by little, until you get to the point where, you know, whatever symptom it was that you were trying to manage is managed. Or if you increase the dose and you start feeling worse, then you know you've hit that tipping point and you need to pull back the dose a little bit. You can give yourself more time for your body to become acclimated to it and then try to increase it again. But with cannabis, more is not necessarily better. So, and it's also expensive, and this isn't covered by insurance. So the way I approach it is, don't take more than you need, and let's figure out what is the very lowest effective dose that's going to give you the results that you're looking for. So I have them keep a diary. I give them the schedule of increases depending on what protocol or what formula they're on. And usually if it's a very low THC protocol, then you can increase it more quickly. And because you aren't dealing with any of the psychoactive or the intoxicating feelings from the THC, and all the other cannabinoids are so well tolerated that the THC component is really what we're trying to manage in terms of how they feel on higher doses.
Right, like what they can handle. Wow. So I think I know the answer to this, but just because you've clearly found your life's calling and passion in helping people do this, but are your tremors completely managed on your protocol?
Yeah, I don't have steady hands. I haven't had steady hands in 15 years, but I'm no longer on the anti-seizure meds, which was a huge relief. And, I'm able to do my day-to-day things without any interference of the tremors. The condition itself, if someone is under any kind of stress, whether it's good stress or bad stress, whether you're laughing really hard or if you're emotionally upset or you're too hot or you're too cold, what happens is the tremors really take off. And so I still have to deal with that. And so there are ways to use cannabis in a way that's going to give you some quick short-term effects. So, yeah.
Wow. What
so
a
then,
story you have.
Yeah, I mean, that's huge that you're off the anti-seizure or tremor meds. I mean, that's a huge accomplishment.
Yeah. I was thrilled.
Oh my gosh. Yeah.
We are excited to have Seeking Health back as a sponsor for Season 2 of the Talk to Me Sister podcast. If you want quality vitamins, you can use our code SISTERS2 for 10% off your next order.
This exclusive coupon gets you 10% off your next order. That's SISTERS2. Visit seekinghealth.com. So, Susan, before we get into specific ways CBD and cannabis help some physical conditions, let's take a couple steps back if we can, just for people listening that don't know a ton about cannabis and CBD and the differences. Can you just give us a quick, just kind of definition of the differences between cannabis and between CBD, and then give us maybe the quick 101 on both of their effects on the body's endocrine system?
Sure. No
it's
problem.
A high level on that.
Yes, of course. So the difference between THC and CBD is that THC is intoxicating. CBD is not. THC is fantastic for moderate to severe pain. It's often used in cancer patients and end-of-life scenarios for that reason. And CBD is better for mild to moderate pain. THC is fantastic for chemotherapy induced nausea and vomiting. And CBD is also great for nausea and vomiting. And CBD is great for epilepsy, whereas THC a little bit, but nowhere near the effectiveness of CBD. So like I was saying, in a cannabis plant, there are 150 different cannabinoids. So THC is a cannabinoid, CBD is a cannabinoid, THCA, which I mentioned earlier, is another cannabinoid. So you have Mother Nature has put all of these different compounds and molecules in this plant. And when you know what the medical effects are of each of the individual cannabinoids, and you know what the patient's issues are, you can match the two, and then you have a much higher chance of resolving whatever the issues are. And a lot of people say, oh my God, how is it possible that cannabis can be just as good for your seizures or your essential tremor? And it's also good for cancer patients who are dealing with nausea. We've kind of been conditioned by the pharmaceutical company to think that you take one drug for one symptom. And then people end up on 18 different prescription meds.
They do, especially later in life, too. They get to take a medication and you get a side effect, and then you take a medication to help that side effect, and it snowballs.
Yes. And it's quite tragic, actually, because with cannabis, since you have all of these compounds in this one plant, you can take one medicine, cannabis, and it's going to manage many things that are going on at the same time. So, for example, with the elderly, they have difficulty sleeping. A lot of them either have anxiety or depression. They have joint pain, arthritis, autoimmune disease, etc. They can't sleep. They're inflamed. So instead of giving them 5 different pharmaceutical drugs to manage each of those issues, they can just take a couple of droppers of cannabis tincture under their tongue a couple times a day, and it manages everything.
Yeah. Wow. I just love that.
I know. It's fantastic.
Yeah. I feel like being just a cancer survivor and doing treatment for over a year, I found that was the best for me too. I needed something. Obviously, I love the natural form and that cannabis is a plant, but I needed something that managed my nausea. And so that's why I kind of first looked into it, because I needed something to kind of curb that side effect, because I could not eat days after treatment. And that was hard because you're trying to build strength to just do treatment again the next day. Exactly. So I found that THC really helped me with appetite. It was hard for me to sleep. I remember in my overnight stays in the hospital, they would give me Benadryl. And like you said earlier, it makes you groggy. Yeah. It made me feel worse. And so Kathy would stay with me in the hospital, but I would sneak in my THC gummies.
Yeah, I love it.
My doctor didn't even know that. But honestly, I swear by it with side effects. And so I actually did a deep dive into podcasts and research and stuff when I was partaking in some of the dosing and trying to figure out what was going to be best for me. I wish I had known you then.
I do too.
But it's interesting because I wanted to ask you a question, because obviously we're talking about physical conditions. We already know, you've already said that THC and CBD help chronic pain, cancer, epilepsy, autoimmune, Parkinson's, Alzheimer's. We talked about the elderly. I'm curious, do you have any cancer patients specifically ever coming to you asking, saying they're just bypassing conventional treatment and they just want to take THC for a cure? Do you ever get there? Because I went down a rabbit hole, and honestly, I found so many success stories this way. And just because you come from a Western medicine background. I'm interested on your take on that, like RSO and different, like, I'm interested in that topic and what you think about that.
Yeah, I have had people come and say they're interested in just doing cannabis, and I always say to them that it's better to use all of the tools in the toolbox that are available to us to fight, especially a life-threatening type of cancer. Mm-hmm. So I would never recommend somebody just go down one avenue.
Yes.
That's what you thought too.
I love to hear you say yes, because it's funny when you're actually in the patient seat, people come out of the woodwork and they want to tell you what they think is best for the way you should survive. Mm-hmm. And I always tell people, I didn't just heal naturally. Kathy and I obviously love everything natural, but we also believe in Western medicine and science. And
when you need it,
when you need it. And
I
chemotherapy is the route that saved me, and I trusted my doctor, and I think she's brilliant. But I do think that cannabis and CBD both together helped me not only fight certain symptoms along the way, but helped me recover quicker. And so I also agree. I'm glad to hear you say that, because we believe the same thing. So.
Yeah. And there are a couple of quick points I want to make for anybody who has this issue. Mm-hmm. Cannabis can be used in two different ways regarding cancer. Number one is just symptom management, and the other two is to help fight the cancer. These are two very different approaches. It sounds like you were using cannabis to manage your symptoms and to speed up your recovery. There is a lot of medical research that shows that particular cannabinoids such as THC, CBD, and CBG are very effective at fighting different types of cancer cells. So for people who do want to use it as an adjunct to their chemotherapy, we use very high doses of RSO, or Rick Simpson oil, which is a concentrated cannabis oil. You will usually get about 700 milligrams of either THC or CBD or CBG in a 1 milliliter syringe. And what I do is I mix that with cocoa butter and make suppositories. The benefits of using suppositories, it's a total game changer. I mean, it's incredible. So anyway, when you use cannabis as a suppository, it bypasses the liver, so you don't get that intense high. So you can tolerate much higher doses. And also there's greater bioavailability, meaning the body can utilize more of the medicine than in any other route of administration. So,
okay, well, I took RSO, and I wish I had known this, because I can tell you, I could not move off my bed. I thought, this is not normal. But I was like, I think it's working, because I can't move my fingers. Yeah. Oh my goodness.
Yeah.
Wait, you said something earlier that I was going to ask you about. You said CBG.
I've never heard of CBG.
Yeah, can you tell us?
We're learning so much, Susan.
I'm so glad. Yeah, so CBG is one of the other cannabinoids, just like THC and CBD and THCV. And each cannabinoid has like its superpowers. So for example, THCV is the cannabinoid that is most metabolically active, meaning that it helps regulate blood sugar, it helps speed up your metabolism, it helps with insulin resistance, it helps with weight loss. So any of those metabolic functions is where THCV comes in. So CBG is just one of the cannabinoids that they've studied specifically for cancer, along with THC and CBD. Those are really the three primary cannabinoids for cancer itself. So if I'm working with a patient, I will usually teach them how to make their own suppositories using the Rick Simpson oil with the different cannabinoids in them. And that not only makes it more tolerable, but it's a lot cheaper. Because if you go to a dispensary and you buy that dosage of cannabis in a suppository, if they even have it, you're paying $50 or about $20 per suppository. If you make it at home, it's about half that cost, and it's very easy to do. So
wow. That's a great thing to pass on to people. They have a skill to be able to do that.
Yeah.
So that's so interesting. I was going to ask you too about, because especially cancer patients, we think of THC as helping with weight gain because it helps with appetite, it helps with nausea. Mm-hmm. But this strain that you're talking about can help with weight loss, because if you're helping with insulin resistance and metabolism, it sounds like this one has a whole different function.
Yes, it does. In fact, there's a pharmaceutical company called GW Pharmaceutical out in the UK, and they put a patent on THCV, and they're currently developing cannabis-based drugs to help treat diabetes, obesity, and that whole constellation of issues.
Right, like the metabolic syndrome blanket.
Exactly. Yeah.
Incredible.
We just wanted to take a minute to say thank you so much for listening. Please don't forget to subscribe to our podcast on Apple, to follow if you're on Spotify, and please take a minute to leave a review. We would be so grateful if you left a review. That's a great way for our podcast to grow. We are going to be releasing a monthly newsletter where we're going to highlight a recent review, and that person gets highlighted on the newsletter, but also gets a gift from one of our sponsors. So thanks so much.
Okay, I have another question. I have so many questions.
Yeah, keep going.
So
I love it.
Of all the different strains and everything we're talking about, so we're in Tennessee. We can't legally buy medical marijuana, which is crazy because when Sarah was sick, that's like what we needed. But now here we can legally get Delta 8, which has CBD plus some THC. And it does have some intoxicating effects. Mm-hmm. I mean,
we've had family members be like, we can't do it.
Anything. Yeah. And it's like, clearly you have to figure out like anything you have to figure out. I'm like, I got to eat like a fourth of a gummy.
Our mother.
And that's good. But
she won't care that we audit her on the podcast.
Yeah. But I want to know what you think about what is Delta 8. Like, I honestly don't even know what it is, but I will say, just for people listening, like regular CBD will jump into like the mental health component, but didn't really help my anxiety. But a little bit of THC has really helped my anxiety, and people sometimes have the opposite effect where THC aggravates their anxiety. Yeah. I'm going forward. Mainly I want to know about Delta 8.
Delta 8, before we get into the mental stuff, because I still have a couple physical questions. So do you come across, like, tell us what Delta 8 is, because in Tennessee we
can legally purchase it.
Yeah, we see that on like a bunch of things combined with CBD. And is there a benefit that they're combined together?
Well, yes. Anytime you have cannabinoids that are combined together, you're going to get a better effect. Mm-hmm. The only time I will recommend isolates, which is, you'll buy just CBD. And if you read the ingredients, it'll say CBD isolate. That means they've just extracted that one molecule from the plant. And it's really the entourage effect, meaning the joint effect of this entire mixture of all of these cannabinoids together, where you're going to get the best response. So back to your question about Delta 8.
Delta 8. Mm-hmm.
Yeah. Delta 8 is more of it does cause some intoxication a little bit, and it's a much softer, it's probably the best way to describe it. It's a softer intoxication. Whereas, like you were saying, Sarah, when you were taking the RSO, you literally could not move a muscle in your body. So that's kind of a heavier intoxication. Now, with the different effects on anxiety, it really has more to do with the terpenes that are in the plant and not so much the cannabinoids, because, there are different strains of cannabis that are very sedating and are great for pain and nausea and all of that. And then those are classified as indicas. And then on the other side of the spectrum, the sativas are more energizing. So if you have anxiety and you're taking a sativa, you're going to get more anxious. If you take the indica, you're going to become more relaxed. Now, the thing that differentiates an indica from a sativa, they both have the THC in them, which is the same molecule, but the terpenes, which are the essential oils in the plant, are the things that distinguish between the indicas and the sativas and how it feels in your body. So if you're looking for a strain that's going to be pain relieving and sedating, you're going to want to find cannabis strains that have linalool and myrcene. And if you're looking for something that's going to energize you, or, a lot of times artists will use sativas to kind of stimulate their creative juices. Mm-hmm. In that case, you want to find cannabis products that have the terpenes of like limonene and, the more energizing essential oils. So that's really
unless you're an anxious artist.
Yes.
Where you're like,
right.
Maybe not.
See, this is encouraging for people though, because sometimes people will try and go, oh, it didn't work for me, but they need to know that, okay, if you're looking for an alternative solution, you need to.
Well, that's why I feel like it's so important to talk to a cannabis nurse specifically, because I do have a lot of people that come into contact with, even like people, not just people fighting cancer, but just friends who are like, well, CBD made me more anxious. But, I feel like that's why you have to find someone with qualification. I have a question about when people come to you, though, because we're in Tennessee. I'm sure you have a ton of out of town clients, right? Do you have kind of like a certain? Do people have to have a medical grade marijuana card to have a consult with you? I mean, are there like stipulations on who you help and who you don't help?
Not really. The only thing, I can consult with anybody, even if they're just looking for some information. If somebody's looking to have guidance with a treatment protocol, if they live in a legal state, mm-hmm. I can go on to Weed Maps and find the dispensaries that are closest to them in their neighborhood and look at their menu and go through and identify products that I think will, meet their needs. Mm-hmm. If I'm here in California, when my clients are here, a lot of them are elderly. A lot of them have really no desire to go into a dispensary. And mm-hmm. so I can set up arrangements either to have the dispensary deliver it to them. Any kind of CBD products I bring with me because those are over the counter and all of that. So depending on which state you're in will determine whether you need a medical marijuana card or a recommendation.
Mm. Okay, before we go to mental, do you have, I love a good testimonial or like a good healing story. Do you have any of those to share?
Oh, I do.
I know we're like already halfway through, but pick like your favorite one. I feel like people love to hear, it's hopeful to hear people's like healing stories and kind of those good testimonials. So,
okay. Well, we've talked a lot about cancer, mm-hmm. And with the tremor, that's movement disorders. One of the other class of health issues that responds so well to cannabis, it's amazing, are autoimmune diseases. So if you have fibromyalgia, if you have MS, if you have Crohn's disease, if you have Hashimoto's, thyroiditis, any of those autoimmune conditions responds very favorably to cannabis. And so I have a client, she's been my client now for about 6 years. She has autoimmune disease. She has lupus. And so the cannabinoids that are best for lupus are THCA or the raw cannabis. And the reason why is because that cannabinoid actually regulates your immune system through your endocannabinoid system, which actually we haven't talked about. And I can explain what that is in a minute. But so anyway, she went from being on, fairly high doses of prednisone and in a lot of pain and just, kind of at her wit's end. She had been followed by a rheumatologist for years. And unfortunately, this is kind of the typical scenario where somebody will try all the options in Western medicine before they start looking for more natural or alternative approaches. So, and that was basically her case where, she had a little boy and she had a hard time just getting out of bed and dealing with life and was really, I've been there. I know what it feels like when your health has become such an obstacle to your daily functioning and the mental and the emotional toll that it can take on you. In my case, I was going through menopause at the same time. I know you guys are really into women's health. And so it was like a double whammy. And that's usually what happens with women when they get to this age, 40 and older, is they start dealing with decreasing levels of estrogen and progesterone and, all the sex hormones and, dealing with the side effects of that. Plus, they're often dealing with another chronic illness. In this case, it was a woman who was diagnosed with lupus, but it could be breast cancer. It could be diabetes. It could be heart disease. All of these things kind of come up for women once they get past their childbearing years. So anyway, she got down to, after we got her on a protocol that was working for her, which included THCA, CBD, and a little bit of THC, we got her prednisone dose down to 2 milligrams, which was completely doable for her. She was out of pain. She was, out of depression and all that goes along with, an initial diagnosis of something like that. And so, and it's kind of a similar story with everybody, and they usually come to me when they're kind of at their wit's end. And then after they use cannabis and they get on the other side, they are like so grateful, just the way I am. I am so grateful for this plant.
Okay. On that, just like on that testimonial and talking about women's health, have you ever had clients going through fertility struggles who have had benefit with CBD or cannabinoids?
That I have not. Okay. And there's kind of conflicting research out there.
Yeah.
Right. There is.
Yeah. Some say, oh, it helps fertility. And others say, oh, it's terrible for fertility. So, I usually don't deal with that sort of thing.
We're real quick, because you mentioned it earlier. Can you tell us quickly about the endocannabinoid system?
Yes.
Like, what is that?
So your endocannabinoid system is your largest neurotransmitting system. It basically communicates with every other system in your body, whether it's your GI system or your nervous system or your musculoskeletal system. It communicates with everything because its job is to maintain homeostasis, meaning it maintains proper balance of everything that's going on in your body. So if you have autoimmune disease and your immune system is running amok and it's tearing down your own tissues, it will bring that overactive immune system down to a more normal level. And this is what the body does naturally. And we produce our own cannabinoids. They're called endocannabinoids. So they have identified that at least 2 of the endocannabinoids that every human produces on their own are 2-AG and anandamide. Those 2 molecules are virtually identical to THC and to CBD. So when we are faced, it's incredible. It's the probably the most significant scientific discovery of the 20th century. They discovered the system in the 90s.
Yeah, it's like the plant is a part of our body.
It is.
Already.
Yeah, I mean, it's been used as medicine for 5,000 years. Humans and this plant have evolved together, and it has been used as food and textiles and all kinds of things. So before there was prohibition on this plant, it was the most widely prescribed drug in the United States. And so we used to have more interaction with it. You know, the farmers would feed hemp to the cows. We would eat the cows and we would ingest the endocannabinoid, or we would ingest cannabinoids. But once they prohibited that, our supply of these phytocannabinoids, which are cannabinoids from plants, basically went away. So that natural supplementation of our diet went away. And at the same time, our body became exposed more and more to toxins and to stress and to all of these things that break down our health. So when you take in cannabis, you're basically supplementing with the same molecules that your body produces naturally in order to maintain health, maintain homeostasis. And if anything's out of balance, whether it's a proliferation of cancer cells or, autoimmune disease, it brings all of those things back into balance holistically. You know, it's not you're taking in a drug that's altering this, which has a result of that. It's like you're giving your body the natural kind of the raw materials it needs to maintain your health.
That's so incredible and such a fascinating discovery too. You, on your website, you give dispensary education. And I'm sure when you have patients do consults with you, they're like, okay, what do we do next? So you talk a lot about that on your site. So maybe as we start to close the episode, you can tell people kind of what you recommend or how to, how to go from there.
Yeah. So the dispensary education is actually two-pronged. One is for the clients, and it's more of a warning than really education. But they just need to understand that they're going into a retail operation and their goal is to sell products. I have actually written down a prescription for a particular brand and a particular formula, given it to the patient. They take it to the dispensary and they have been told, we don't carry that, but we have this over here, which is just the same. And it's not.
Yeah. I would feel like that could be risky too, with like what you've really worked really hard to get this exact prescription.
You're probably like, you probably tell your patients, ask me if they do that.
Yeah, exactly.
Because I can throw the whole thing off. Yeah,
exactly. And then the second prong on the dispensary education is, I do whatever I can to encourage dispensaries to have educated staff. A lot of the dispensaries here in California, anyway, they're mainly staffed by younger people who have absolutely no education in health or even what cannabis does. So an elderly person will go in there, and this has happened when I have been in a dispensary and I have to intervene because I feel compelled to. But a bud tender will say to an elderly person, take about 20 milligrams of THC, and my eyes get as big as saucers because I start with about 2.5 milligrams.
Wow. Yes.
And they're getting somebody who's never used cannabis before, this mega dose that for them, because they've used it for so long or they've gotten, so used to it, 20 milligrams for them is nothing. But you can't tell them.
Yeah, I would love to be in line with you, Susan, where you picked your moment. You were like, actually, I'm a cannabis nurse. Let me take this from here. Yeah.
Oh my goodness. Well, that's insane. So, will you tell the listeners how to connect with you if they want to do a one-on-one consult and where they can find you?
Yes, absolutely. So you can just send me an email. My email address is Susan, SUSAN, at dearnursesusan.com. And a lot of times people say, why did you call it Dear Nurse Susan? Well, I'm old enough that I remember Dear Abby. I don't know if you do. but it was people sending in questions about one thing or another. So I always am getting questions. So that's why I called it Dear
I
Nurse
love it.
Susan.
I think that's so cute. Yeah. And we'll put your email in the show notes. So anybody who didn't have a pen and paper, just check the show notes and her email will
We're
be
so glad
there.
that we have a reference now that we can send people to, because Kathy and I believe, like, we actually have a lot of Kathy's in women's health, and then I'm a cancer survivor. So we get like a slew of women who have questions about health, and like Kathy has credentials. I just have the experience. So I'm glad that we have somebody like specific
building
to
our repertoire.
and you have credibility. Yeah, I'm just excited to have connected with you. So.
Yes, amazing.
And I'm so glad you guys are doing what you're doing, especially in women's health, because women have been so overlooked, and they have, especially when they get older or they go through, premature menopause because of cancer or, whatever. Yes,
absolutely.
Exactly.
Well, thank you, Susan.
Yeah. So I appreciate that you guys do what you do too.
Well, that means a whole lot. We are trying to spread awareness. And before we go, because we're about to hit the 50-minute mark, I feel like we could talk to you for hours. Actually, I have more questions, so we can talk. Maybe you can come back on the podcast. But
I would love to.
Before we go, we always we give the guest the last say, and we always try to just encourage our listeners who are maybe dealing with autoimmune disorders or just like really frustrated with their health. So could you leave us with just like a word of advice or some word of encouragement?
Yeah, so I would say that there are a lot of tools available to all of us. It doesn't just have to be in Western medicine or just in Eastern medicine. I have found throughout the years that when you combine these different modalities is where you're going to see your best response. So don't be afraid to, try the more natural approaches before you leap into prescription meds. Of course, depending on what the issue is. If you have an infection and they have to give you antibiotics, don't go the natural way. Just take the antibiotics. But,
that's important.
Yeah. But if you have, some other lifestyle induced issue, try the natural approach, try changing your lifestyle, and don't be shy. Ask a lot of questions, go to a lot of people, look on, the internet or YouTube, or go to conferences on these alternative methods. You'll learn a lot, and for me it's fun, and it just raises the bar on hope and the ability to really tackle these kinds of issues. So hang in there.
Raises the bar on hope. I love that line. Gives you options.
Yes. And
you're not stuck.
Yeah. Because sometimes, some people, they go to the doctor and they think that that's it. So
thank you.
It does raise the bar on hope. Susan, thank you so much.
Oh, this was so fun, you guys. And anytime you want to continue the conversation, I'd love to.
I think
Sounds
we
amazing.
really should.
Yeah.
I really appreciate you coming on. Thank you so much.
Thank you for listening to our podcast. Also, make sure to check out our Amazon store. Thank you.